Chlamydia is informally called the silent STI, the silent STD, says sexually transmitted infection, sexually transmitted disease. It's a bacterial infection. And the reason it's called the silent STI is because most of the people usually don't get the symptoms once they have this infection already. Around 40 to 96% of people who usually get this infection don't show any sign. But the bad side is, despite not having the signs and symptoms, prolonged exposure to this infection can give you complications later in life, like you're going to see later in this video. But we have several things that we need to answer in this video. Now that it's a silent STI, how can you know that you have this infection? And after you discover that you have this infection, how do you actually treat it? Plus, can you get this infection subsequently? Like you treated successively, can you get it later? Because you have infections whereby once you have this infection, your body will get to have antibodies so that next time when you have the same infection, it will be harder for that infection to establish itself in the body because you already have the antibodies. You're going to see this later. Chlamydia is a very common STI, actually very common. It's a major cause of the STIs. I'm going to use STI in this video because it's mostly asymptomatic, so calling it a disease will be when you start getting the pathological effects of the disease. So I'm going to use STI. Anyway, it's caused by a bacteria that we call Chlamydia trachomatis, and people who usually have this infection don't show the signs like we mentioned above. And the bad side is it can cause pathological effects that will affect you in your sexual health and even your fertility. Now, how is it transmitted? Of course, sexually. Now, if you come into contact with someone with this infection, so long as you get to touch any place that is affected by this bacteria. And one thing you have to understand is most of the STIs or the sexually transmitted infection, we have gonorrhea, we have syphilis, the bacterial ones, they usually prefer areas that you have the mucosa, the wet areas. You have the eyes, the mouth, you have the anal region, we have the penis, because you have now the opening of the penis, and also the vagina where you have something that we call mucosa. They love those areas, so this is not an exception, so it's going to affect those areas. Now, unprotected sex, penetrative sex, they will actually give you that. Now, you don't actually have to have the penetration. So long as you touch the fluid that contains this bacteria, you by default get it. Now, newborns or the children, we get this through childbirth. Now, in case the mother is infected by this bacteria, during the time when they're giving birth, they might likely going to get this infection. So that's why it's very important during the ANC visits, it's good to have this infection checked so that you don't get to transmit this to the unborn or during the childbirth. Now, the eyes can also get the infection, and this is mostly due to contacts. Maybe, for example, you've been touching areas where that infection already is, and then you touch your eyes, you transfer that bacteria to that area, and because you have mucosa also there, it's most likely going to have that infection, and we are going to see some of the things that you usually get in your eyes once you get this infection. Now, you can get chlamydia unlimited times, meaning that you can get this infection, treat it successively, but then you get exposed again, you get the infection. That's why it's usually very important for you to, when you're getting treated for this infection, it's good to also have your partner treated in case they have that. And yeah, because if you get treated and you so happen to go back to the same partner who maybe still have that infection, you're also going to get the infection back. Now, what are the symptoms? Now, like we said, chlamydia is a silent infection, meaning that most of the people will not have the symptoms, but we have some few individuals that will have the infection, or when you have an advanced infection with this bacteria, you are going to show some signs and symptoms because of the pathological effects of this infection in your body, one of which is pain. Pain will come in areas where you have that inflammation. Whether it's in the eyes, you're going to have that pain. Whether it's in your mouth, you're going to start having the sore throat and all those infection. But you're going to see that when it comes to now the chlamydia in the mouth, when it comes to the complications. But you have the burning sensation when urinating. When this is common to almost every STI, actually in all STIs, you're going to have burning sensation when it comes to urinating. And this can be, like I mentioned in a previous video about gonorrhea, it can be tricky in men because men shares urethra both as a reproductive organ and also as a urinary organ, because that's where the urine will pass, that's where the semen will pass also. So when you have an infection there, it will be hard to tell whether you have UTI or STI. For ladies, you have the organs they are separate, and it's actually easier for them because we can be able to do a differential diagnosis whereby I take a swab from the vagina or I just take urine that will come with what she's suffering from. In case that was UTI, in case it is STI, then I'm going to see the infection in the swab, what we usually call high vaginal swab. Women are most likely going to acquire this infection compared to men, and this is obvious, especially when it comes to the sexual contact. Women usually have a larger surface area when it comes to the mucosa, and like we said, it loves the bacteria. Usually, most of the STIs, the bacteria usually love wet places. Now, that vagina, it comprises a very huge compared to men. It's bigger. The surface area is bigger compared to men. Men, the only exposed part will be the opening side where the sperms will come out. So that opening is where the likelihood of getting the infection will be initiated. Now, comparing that area to women, men will have a lower chance. Women usually get this, and to compound with the effect that women will take a little bit longer before they even know they have the infection, or even not know at all, it compounds the effect. Now, there's several things that you can also observe when you have this infection. Abnormal discharge from the penis or the vagina, because you have the infection there. The body is trying to fight off the bacteria that's already there. So you're going to have that inflammation that will come with the discharge. Now, some of the symptoms of chlamydia may also differ slightly between men and women. Now, let's get some of those symptoms in men. Okay, they can overlap, but sometimes it can be there, like specifically for men. Now, in addition to the burning sensation during urination or having the discharge coming from the penis, and the discharge will be yellow, greenish, and will come from the penis, the tip of the penis. Now, pain in the lower abdomen. This can also happen in women, like you're going to see, but pain in the testicles is characteristic because now, the infection, like we mentioned in gonorrhea, it will move, even syphilis. It will move upwards, and it can branch, go all the way to the bladder. That's why you're going to get the pain in the lower abdomen. But then when it goes via vas deferens, it goes to epididymis, and into your testes, you're going to have swollen testicles and also pain there because you're going to have inflammation already there. And that's a bad thing because now it can interfere with your fertility when it comes to men. Before you go to women, it's possible to catch this infection in the anal region. Now, this usually comes with some symptoms like a discharge, pain, and bleeding, especially when you're passing your bowel in that area because it's already inflamed. You have an infection there, so you're basically going to have the discharge, pain, and bleeding. And also oral. If you're having maybe oral sex, chlamydia, you can get that infection in your throat. And symptoms include the sore throat, coughing, fever, and this is cross-cutting anyone. So a female or even a male can be able to get this infection in their throat. And also, it's usually very possible to carry the bacteria in the throat and not know. So you might either confuse this for other infection, like maybe cold, you have other infection that can cause sore throat or maybe cough. And the fact that we say that you can have this infection without even knowing, it can even stay there in the mouth without even you knowing, and at the same time you're still transmitting it. Now let's go to women. Now, in women, if you contract this STI, it may take several weeks, especially compared to men, before you even start getting the symptoms. Some of the most common symptoms of chlamydia in women will include painful when it comes to sexual intercourse because of the inflammation of the vaginal wall. So there, you're also going to have vaginal discharge, burning sensation during urination because it can also affect the urinary tract. It can go upward. So you can also have that burning sensation. And when you have that inflammation, that urine, when it comes to contact with your labia, you might also start getting the pain, the burning sensation. Now, pain in the lower abdomen, and this is mostly due to the complication we are going to go into, what we call PID, which is pelvic inflammatory disease, when the bacteria moves to the upper regions when it comes to the reproductive tract, your cervix, your abdomen, fallopian tube, your ovary. Now, inflammation of the cervix, what we call cervicitis, and also bleeding between the periods. In some women, the infection can spread to the fallopian tube, like we said, the PID. Now, PID is usually a medical emergency because now if you have this infection, it can lead to you being infertile. basically what usually happen is you're going to have inflammation because now you have this bacteria now in your vaginal canal, in the cervix, up in the uterus, and also in the fallopian tube to an extent of going all the way to the ovaries. And you know what this means? If you have an inflammation, especially when it comes to the fallopian tube, you're going to have the scarring, and this scarring can do two things. One, it can prevent sperms from going. In case you have a scar there, you're going to have issues when it comes to the closing because it can make the passage narrower for the passage of the sperms. And also, the scar tissue will affect the cilia that usually propel the egg forward. Take, for example, you had ovulation and you met your partner, so there was fertilization. Whatever will happen here is because you have the scar tissue, passing of that egg towards the uterus once it's fertilized, it will become harder because one of the scar tissue, which can make the passage narrower, meaning that it cannot fit, sometimes it cannot fit. Or if it can fit, you have the cilia that are affected by the scar. Cilia usually help in propelling the egg forward. So if the movement is affected, it means that now the egg will stay there stationarily and you're going to get ectopic pregnancy. And this is what we call risky pregnancies. You'll have to have that stopped because it's a medical emergency. What are the symptoms of the PID? Now you have fever, we have severe pelvic pain, we have nausea, we have abnormal vaginal bleeding between the periods, and when your doctor uses the speculum to observe your cervix, you're going to have a very nasty discharge coming out of there. It will be yellowish, greenish, and sometimes very smelly. Chlamydia is more common in women, like we mentioned, and actually it is estimated that women are 2 times more likely going to get the infection compared to men. And the age which is mostly affected is between age 15 to 24 because this is where they are mostly going to be sexually active. If left untreated, we have complications that it can come with. One of which is what we've just discussed, PID, which is an infection that can cause you or can make you to become infertile. Now, infertility because of the scarred tube and also preventing the movement. Babies during birth, they can get this infection and mostly in their eyes. And they can also get the pneumonia due to this because once they get that in their mouth, they are going to have that infection affecting their upper respiratory system and it can transcend down to their lungs causing pneumonia. Now, we have complications when it comes to men. The epididymis, which is the tube that usually holds the testicle in place and also temporarily stores the sperms, can become inflamed, causing pain, and this is what we call epididymitis. Now, the infection can spread to the prostate gland, causing fever, painful intercourse, and discomfort in the lower back. Yes, it's quite common, and sometimes you cannot even know what's causing this, so you end up having that pain. So that's why it's usually very important in case you have any pain, discomfort in your testicles, in your back, you need to see a doctor. When you're having that pain when you're urinating, you really need to go and see a doctor. Now, these are just some few of the most common complications that you can get with untreated chlamydia, which is why it's very important for you to always get screened for this right away, especially if you are sexually active. It's sometimes very important for you to go get screened. Now, how do you know that you have this infection? Now, we have diagnosis. Several things can be done. Now, we have kits that you can actually buy and test yourself at home. We have those, you can just go to your local pharmacy or maybe your online pharmacy, just go and buy that and buy them. Looking for pharmacies that I can be referring to, especially when it comes to things like this. So I'll try as much as possible to do a due diligence, look for the pharmacies that will be assisting my people so that in case maybe, anyway, if you're a pharmacy and you know that you can be able to support what we are doing here, you can actually email us and we get to see whether we can be able to afford that. We are located in Kenya, in Nairobi, so in case maybe you have an access, if you can give us an access to a pharmacy, well and good. And actually, before you even go further, I'll have to go and assess your pharmacy, yes, the capability of your pharmacy to, or even your hospital to offer what we are talking about here, before I recommend that to people. So yeah, anyway, moving on, we have swabs. Now, the swabs will be, you have an infection in your throat, it can be swabbed and tested. You have that discharge can be taken to the laboratory and observed under a microscope. We have special stains for that. And as well as the signs. If your doctor comes and observe, they can tell whether you have that infection or not. Plus, you have differential tests. Like, for example, you might maybe think that you have syphilis, so we have tests for syphilis to rule out whether you have that syphilis or not, and then maybe remain with the chlamydia. Now, treatment, like I usually say, bacterial infection are usually straightforward, unless you so decided to not take the full dose. Now, chlamydia is easy to treat and can be cured completely. So, because it's a bacterial infection, the only thing that you need is antibiotics. Some of the antibiotics which I usually use, you have azithromycin, which is an antibiotic which is usually prescribed as a single large dose. So you have one dose azithromycin, but you have doxycycline, which is an antibiotic that might be taken twice a day for about 1 week for you to clear this infection. Now, your doctor might decide to even prescribe other antibiotics as available to them, or the one that will make more sense to him. Because maybe you have another infection like a gonorrhea infection. If you have that infection and also you have chlamydia, you can just only use one antibiotic for all of that, or maybe your doctor can decide to give you added antibiotics to fight everything at the same time. So yeah, your doctor will decide about how they are going to treat that. Now, the dosage and the instructions should be followed to the letter, because we have something that we call antibiotic resistance, which is now giving birth to super gonorrhea, making rounds, a gonorrhea that cannot be treated by the antibiotics you already have. So for you to make sure that you don't contribute to that, or maybe you don't get to have that infection that cannot be treated, always make sure that you complete the dosage all the time. Now, there's something else I want to tell, especially the ladies. When you take antibiotics, especially for 1 week, 2 weeks, you are prone to getting candida infection. This is mostly because some of the antibiotics we usually use are supposed to kill more than one bacteria. So some of the good bacteria can be caught in the crossfire. So some of that will die, and guess what? Because you did not use antifungal, the available space that was left with the dead bacteria that you killed will be occupied by the overgrowing yeast. You're supposed to have yeast, yes, as a normal flora, but a certain level. You're not supposed to have an overgrowth of them. So they're going to overgrow and you start getting the discharge. So once you take a little bit long when you're taking the antibiotics, you're going to suffer from this. And the good thing is your body can restore that over time. So your immunity will take over, fight over the excess of that, and give time for more of the normal flora to grow and occupy the space. But in case this is taking longer than necessary, probiotics can help. So you can just go to your doctor, look for the probiotics to insert there, and then the growth will take place and you'll be back to you being nice and well functioning. Anyway, no sex during treatment. Because you can also, like we said, you can also get this infection even after successful treatment. That's why you need to also treat your partner in case you so happen to have gotten that infection from them, or maybe you so have happened to transmit that to them. So you need to bring them to the hospital also to have that infection checked. And also they should be treated. Chlamydia and gonorrhea usually overlap by the signs and symptoms. If you want to know the difference between the two, check my video on gonorrhea. I think I should link it here or maybe somewhere here, but I'm going to link it there so that you also get to see the difference between them. And also while at it, you can also check a video on syphilis, because I think STI sometimes they can overlap. Although most of the treatments, because they are bacterial infection, they can be treated by common antibiotics.